Right here is the document, the very document that Doug Levac did sign for me and did leave his comments on. I would just like to read this to you, because it is different from the one that I tried to get Dr. Harris to acknowledge. I am thankful that Doug Levac did acknowledge this. All it says is that he knows it exists, and that's all I wanted from Dr. Harris, too. This one for Doug Levac says, I, Doug Levac, am a licensed mental health social worker and alcohol abuse counselor for Aroostook Mental Health Center located in northern Aroostook, Maine. Northern Aroostook County, Maine. My client, Mark Jerkins, who reports that he suffers from extreme anxiety, depression, and sleep disorder, as well as constant aches and pains as a result of severe injuries he has sustained throughout his life, and is now voicing a desire to grow, produce, and manage his own medication in the form of medical marijuana. He states that not being able to consistently do this in the past has resulted in his attempts to medicate these problems with the use of other much more harmful methods such as alcohol and other illicit drug use. He states that he has also tried to medicate these problems using his doctor's prescribed medications, and has not only not benefited from the use of them, but is now experiencing other physical and emotional problems as a result of the use of them. He states that for a period of about 15 years, he was inadvertently addicted to the use of very powerful prescription narcotics while under the care of his medical providers, which only resulted in very serious harm to himself. He states that he, for as far back as he can recall, has been very successful with self-management of these problems whenever he has been consistently able to do so with nothing more than the use of the marijuana that he has been able to grow and produce for himself in the past. He states that he is no longer willing to experiment with other forms of medication and has every intention to provide his own medication from this point on, and I do acknowledge that the state of Maine does in fact allow for this in cases such as his, but I have refused to recommend the full reinstatement of his Maine state driver's license based on the fact that he continues to use his medication illicitly. I lost my driver's license 1 year ago as a result of a first offense OUI. My suspension was for 90 days. I had to pay a $300 fine, or was it $1,000, or something like that. And I had to do 2 days in jail. I'm supposed to complete the DEEP course, which is the the Driver's Education Evaluation Program here in Maine, and be certified that I am no longer going to be driving impaired by alcohol, at least, because that's what the offense was for. But during the time that I was seeking help with that problem, with the alcohol addiction and other addiction problems as a result of not being able to use my medicine properly, I divulged on my own, openly, without any prodding or anything, that I also use marijuana. And now they've been using the fact that I use marijuana, even though I state I am using it medically and I can prove that I qualify for that. Here is what his response to this letter was. I have not refused to do clients DEEP-TX, period. The DEEP office, or the Office of Substance Abuse, has not taken a stance on medical marijuana. Once protocol and resolutions are in place, and we can verify that he will be able to drive unimpaired. He left it at that, period. There it is once again. If you have any questions, that is his signature and that is his writing, and this is the original document. It even has the coffee I spilled on it while I was visiting him.